As many as 10 million Americans suffer from some form of social phobia, which is also known as social anxiety disorder. Social phobia involves intensified distress as a response to public situations. I'm taking great pleasure to share with you insight about the presentation and treatments of social phobia, including the FDA approved and off label treatments based on a case of a 35-year-old man who was anxious about making a speech to 100 people and bearing the risk of losing his new position at work. Peace and light, primary physicians. My name is Dr. Sonia Fulgham. The diagnostic criteria for social phobias is well defined in the DSM-5. They include individuals present with marked anxiety or fear that is attributable to exposure to at least one social situation with the potential of being scrutinized by others. In our case here, the thought of giving a speech in front of 100 people denotes this criteria, with the man in question having negative evaluations of the potential outcome of giving the speech. The anxiety or fear is disproportionately excessive compared to the actual threat that the social situation caused. The social situation, like giving the speech in our case, causes the individual anxiety or fear. The individual endures or avoids the social situations with intense anxiety or fear. Avoiding the situation, the anxiety or the fear leads to clinically significant distress or impairment in occupation, social, or other important areas of functioning. An example of this is how the man in the case is distressed by and keeps worrying about making the speech, that it keeps him from sleeping. The intense anxiety, avoidance, or fear is not because of physiological effects that are traceable to a substance or a given medical condition. The symptoms related to avoidance, anxiety, and fear cannot be explained by another mental disorder or symptoms like panic disorder. Although psychotherapeutic interventions and primarily cognitive behavioral therapy are recommended for individuals with social anxiety, the FDA has also approved some medications. Our client's social phobia can be treated by administering selective serotonin reuptake inhibitors, SSRIs, whose mechanism of action is to inhibit the reuptake of serotonin selectively, as the name suggests. Examples of the FDA approved SSRIs are Celexa, Citalopram, Lexapro, Escitalopram, Levox, fluvoxamine, paroxetine, Paxil, Prozac, fluoxetine, Zoloft, sertraline, and Effexor, venlafaxine. The FDA has also approved some serotonin norepinephrine reuptake inhibitors, SNRIs, like venlafaxine, which is although they are not as commonly used as SSRIs. Now, it should be expected that our client might suffer from some side effects upon taking an antidepressant, whether as the only intervention or in combination with another intervention. He may, for instance, experience sleep disturbances even though he already has expressed difficulty in sleeping due to the fear and anxiety caused by the thought of public speaking in 2 weeks. Nausea, either spikes and drops in his appetite, sexual dysfunctions, including but not limited to erectile dysfunction, dry mouth, and headaches. Now let's review the SSRIs and SNRIs and even consider some benzodiazepines and buspirone without as much as notable effects in toning down the social phobias in our client. It may be necessary to consider off label prescriptions. Basically, off label means that we would be prescribing medications that the FDA has not listed under FDA approval for treating social phobias. Some of the considerations we could make are pregabalin, Lyrica, is approved for fibromyalgia, diabetic neuropathy, and post-diuretic neuropathy. Its possible mechanism of action entails inhibition of GABA aminobutyric acid or GABA reuptake and has approval in Europe and not in the US. Altogether, pregabalin could prove useful in treating our client's social phobia if extant literature is anything to go by. While approved for post-traumatic neuralgia and epilepsy, gabapentin or Neurontin has been shown to be useful in the treatment of social phobia. Another option would be tagabine or gabatril, which is FDA approved for epilepsy, but has the potential to treat social phobias. Quantapine XR, which is sold as Seroquel XR, can be prescribed for social phobias, although it is approved by the FDA for mixed and manic bipolar disorder episodes, schizophrenia, and monotherapy for bipolar depression. Like the FDA approved medications for treating social phobia, prescribing or administering off label treatments for our client could result in some side effects. For example, pregabalin, which is sold under Lyrica brand name, is presented with chances of being addictive and causing sedation and dizziness, or causing weight gain. Administering gabapentin or Neurontin to our client could result in side effects such as dizziness and sedation. The common side effect that the client is likely to experience with tagabin or gabatril include fatigue, somnolence, nausea, headache, and or dizziness. The Quatapin XR has rejected by the FDA for general anxiety disorder due to long-term worrisome side effects including somnolence or sedation and weight gain. Social phobia may be treated using either daily treatments or situational treatment. Situational treatment tends to be short term and often entails the use of anti anxiety drugs. For our client, daily treatment would be more appropriate for the following reasons. The client has suffered from social phobias for a very long time, and long term solutions would be more ideal. Previously, he could avoid public speaking with huge audiences, but this is no longer the case given the new position at work. As such, public speaking is seemingly going to be entrenched in his daily life, and dealing with this social anxiety in long terms would be the best approach. The patient has about 2 weeks to work on social phobias and deliver the public speech, which would be enough time for daily treatment options such as using SSRIs to take effect and help the client take control of the anxiety or fear long before the presentation and continue with the treatment thereafter for more long-term containment of the social phobia. Now, before ending this presentation, here are some key points to note. The first one is social phobias is also referred to as social anxiety disorder and affects about 10 million Americans. It is characterized by distress in reaction to giving public situations such as public speaking. SSRIs are the most common pharmacotherapeutic interventions that are used in the treatment of social phobia. Both FDA approved drugs for the treatment of social phobia as well as drugs that are approved by the FDA for treatment of other conditions such as epilepsy and diabetic neuropathy may be used for treating social phobias. Although situational treatment may be employed when the desired treatment impact is short term, daily treatment is preferred when the social phobia has presented for long and the desired outcomes are long term containment of the social phobic reaction. So, thank you so much for your attention to this presentation, and I hope that it makes useful contribution to your practice. Have an amazing day on purpose. Peace and light.